Welcome to the Exam Room Live, brought to you by the Physicians Committee. Hi, I am the weight loss champion, Chuck Carroll, and this is the healthiest half hour anywhere online today. Appreciate you joining us right here on Facebook and on YouTube as we do our best to educate, enlighten, and inspire for the next little while. On tap today, children and the coronavirus. A new study is revealing just how vulnerable they can be to infection. That's important information as we creep closer toward the beginning of a new school year. Dr. Barnard is here with the latest data and what it is that you need to know. Dr. Barnard, looking forward to hearing from you, sir.
You bet, Chuck.
And Dr. Loomis from the documentary The Game Changers. Dr. Jim Loomis will also be here when we open up the doctor's mailbag, teaming up with Dr. Barnard to bring two of the leading voices in health and preventative medicine straight to you to answer your questions. Dr. Loomis, appreciate you taking the time, sir.
Thank you, Chuck. Always a pleasure to be here.
So go ahead and post your questions now in the comments section. They will be opening up the doctor's mailbag in just a little bit to raise our health IQs all together. But first, let's get caught up on the latest happenings. Here are your health headlines for Friday, July 31st, 2020. Nearly 70,000 new cases of coronavirus were reported on Thursday, bringing the total number of infections in the U.S. within striking distance of 4.5 million. Among the states now seeing the most significant increase is New Jersey, which had seen its weekly average plummet following April's massive outbreak in the New York City area. Cases there nearly doubling over the past week. Meanwhile, COVID-19 related deaths topped 1,000 for a fourth straight day Thursday, pushing the total to more than 152,000. And now researchers at the University of Washington are projecting that rate will remain largely unchanged for the foreseeable future, forecasting fatalities to reach 230,000 by November 1st. Facing backlash amid reports of unsafe work conditions for thousands of employees, Tyson Foods now says it will begin weekly coronavirus testing for employees at its 140 meat processing plants in the U.S. The move comes 5 months into the pandemic and after more than 38,000 meatpacking workers became infected with COVID-19, nearly 200 of which unfortunately died. Outbreaks of the virus have been reported now at more than 380 slaughterhouses nationwide. In other news, leading researchers in the battle against Alzheimer's and dementia say 40% of all cases can either be delayed or prevented. The statement from the Lancet Commission on Dementia Prevention comes as the group adds 3 new steps to its list of preventative measures that can significantly reduce the risk of developing the conditions. The steps: avoid excessive alcohol intake, head injuries, and air pollution. They join previously identified factors such as increasing education early in life, combating hearing loss, high blood pressure, obesity, and depression. The commission also recommends quitting smoking and becoming more physically active. Research shows plant-based diets are also beneficial in prevention of Alzheimer's. Currently, 1 in 3 seniors in the U.S. dies with some form of dementia. And finally, how about this for a job? A company is offering to pay people $2,500 to go vegan for just 1 month. The goal is to create case studies demonstrating the impact that a plant-based diet can have on a person's health and fitness. But there is a catch. Applicants must currently eat a meat-heavy diet and live in one of the most carnivorous parts of the country. Now, according to Vegan Lifts, which is the company behind this offer, those areas include the states of Mississippi, Nebraska, Texas, and Indiana. Moving on, with the new school year just weeks away, claims that children are immune to the coronavirus are being called into question by a new study. So, to what level are children actually vulnerable and able to infect others? Here now with the latest from a new study is Dr. Neal Barnard. And Dr. Barnard, just this morning, the head of the CDC testified on Capitol Hill that he wants his own grandchildren back in school this fall, but only if it can be done safely. So what does this study say about the prospect of that happening?
Well, Chuck, that's a big if it can be done safely. And everywhere in every single school district, the parents and teachers and principals and administrators are really wringing their hands to try to figure out how to do this. And let me show you the latest study that you were mentioning. It was done in Chicago. It was done at the Children's Hospital in Chicago. And they looked at 145 cases of COVID-19 in young people. So the kids had been infected, and they then separated them by age. Some of the kids were less than 5, some were 5 to 17, some were over 17. And then they looked at who has the most virus in their body, the biggest viral load. In other words, who's packing a lot of virus so that when they interact with others, they are most likely to be, at least potentially, we think, at risk. Was it the less than 5s, the 5 to 17, or the over 17? And the answer was, it was the youngest kids. They had the highest viral load. Now, where are they getting it? They're not hanging out at a bar. They're not going into a restaurant. They're not going to the mall or whatever. So where are they picking it up? Well, we know a lot about how you catch the virus. And we showed this a week or two ago, and I want to just come back to it again. If the virus is in a droplet, meaning the little bits of virus are in a bit of saliva or other moisture that comes out of your mouth or your nose, and if it's in a droplet form that's relatively large, it falls to the ground. But on the other hand, let's say it came out in a very tiny little package and it was aerosolized, and then you'd imagine that could just be borne on the breeze that comes in your window. So which is it? Is it the droplet that's just maybe in a very small radius around you, or an aerosol that could just be anywhere? Well, the droplets are the transmission mode for the cold virus, also for influenza viruses. But the aerosols are for measles, chickenpox, tuberculosis, much more transmissible, easier to get from somebody you can't identify. So what's the main method of transmission for the COVID virus? Well, one way you can figure that out is if it was just these heavy droplets, you're not going to really be able to hit very many people with it because they're just not close to you. So you can infect some people, not very many. If it's aerosolized, then an aerosol can reach a lot greater number. And so what researchers look at is, for every infected person, how many other people can you attribute to their infection? And if it's high, that means it's aerosols. If it's low, that means it's droplets. So what do? With measles, one measles patient on average infects 18 other people. That's strong evidence that they are putting it into the air as an aerosol. Now, but with the COVID-19, so far it's about 2.5. So what that argues, according to this paper that came out in JAMA, is that it's not the aerosols, it's really the droplets. So it's possible that it could be aerosolized. That doesn't really seem to be the big thing. So what this means for kids is that if kids are picking it up, they are not picking it up because you went out to the park and they breathed the air, or you opened the windows and things came in. That's not it. They're getting it from people around them. They're getting it from other kids at daycare, or other kids who come over, or their family members who went out and picked it up, or they're getting it from packages and things that you brought into the home. And in turn, if they transmit it to you, they're not transmitting it to you because they're on the other side of the room. They're transmitting it to you through droplets that get directly onto you. So that means hygiene, distancing, masks are as important as we ever thought that they were.
And I think that's a really good point that I think is getting overlooked to a large part in this discussion right now. It's not just whether or not a child can become infected. It's about how much they can actually spread that virus, bring it home to somebody who is more vulnerable to have a severe case of COVID-19. So that's actually very good information, Dr. Barnard. Greatly appreciate it.
Chuck, I got to say, that's the whole issue about schools is, yeah, you don't want your kid to get infected. But you don't want the teacher to get infected from the kids, or the janitor, or the people in the food service, or the principal, or so forth, because those are the people who are more likely to die of it. You don't want anybody to get it, but it's not only the kids we're concerned about. We're concerned about everybody.
Absolutely. All right, Dr. Barnard, something to keep an eye on. I greatly appreciate it. But for now, we need to move on, and it is time to open up the doctor's mailbag and answer your health and nutrition questions. It's kind of become a Friday tradition around here for Dr. Jim Loomis to join us for this. He is the medical director at the Barnard Medical Center. Dr. Loomis, I'm going to pose the first question to you, my friend. It comes to us from Pamela. She wants to know, how do I get iron on a plant-based diet? What foods should I be eating?
So that's a great question. most people who eat a omnivorous diet don't have to worry too much about iron because they're consuming basically dead animal blood. The iron that's in animal products is called heme iron. Hemoglobin is the protein in our blood that carries oxygen, and there's iron attached to it. So when we consume animals, we're consuming some of their blood, and we get iron as a source. It's very easy for our bodies to absorb heme iron. There's issues with heme iron though. Heme iron is highly oxidative. It's highly inflammatory. So that there's an association between high levels of heme iron intake and things like heart disease and cancer risk and things like that. The other problem with heme iron is our bodies will absorb as much as we consume, and we can't excrete extra iron. So the iron builds up in our liver, and it can cause a problem called hemochromatosis and such as that. However, there is iron in plants. Plant foods like legumes and even green leafy vegetables, molasses, all great sources of iron. However, the iron in plants is non-heme iron. It's not bound to hemoglobin. Now, there's some advantages to that because non-heme iron is self-regulating. So when your iron stores are replete, your body will stop absorbing extra heme iron. So you don't need to worry about iron overload. However, it is harder for our bodies to absorb heme iron. And the key is you have to co-ingest it with a source of vitamin C. Vitamin C co-ingestion with non-heme iron, you'll see absorption rates of iron higher than that of heme iron, in fact. So the idea is that, you put a little lemon juice or lime juice on a salad or put in a salad dressing, you finish off a soup or a stew, you snack on citrus fruits or other high vitamin C foods like bell peppers, an excellent source. So iron is more of a theoretic nutrient of concern, but you do have to be diligent and aware of the fact that you do need this vitamin C source to go with it.
Just to be clear, Harry, you're talking about eating these things together. What if somebody's thinking, well, if I pop a vitamin C supplement with breakfast, should I be good to go with that salad at dinner time? Will I still absorb that iron?
Well, it needs to be fairly proximal to the ingestion of the iron source too, because you need it to absorb it. So it has to be both kind of in your stomach around the same time.
There you go. Good tip. Sticking with you, Dr. Loomis. This one comes to us from Jeannie at 11:59. She writes, unfortunately, I lost my job due to COVID and need to stay on a budget. Is it okay to eat oatmeal for breakfast every day? I love beans, rice, potatoes, pasta, and buy seasonal produce to also keep costs down.
Sure. There's nothing wrong. I eat oatmeal pretty much every day. And, there's a lot of tips to increase the nutrition that you get in oatmeal. Oatmeal's, especially I'm not talking about the little packets of oatmeal that are full of sugar and additives. I'm talking about even instant oats, or steel cut oats, rolled oats. They're all healthful. But you can increase the healthfulness by adding, and again, if you're on a budget, you can buy big bags of frozen fruit, blueberries at Costco fairly inexpensively. You can get big bags of flaxseed and things like that. Again, not without spending a lot of money. And by adding these various things to the oatmeal, you take something that's healthy and has 5-6 grams of fiber and 5-6 grams of protein into something that's really almost a superfood that's got now 7-8 grams of fiber and more than enough protein to help you get through the day. So certainly there's nothing wrong with eating oatmeal every morning.
And Jeannie, as you continue your job search, hopefully prospects turn around. There's actually a couple episodes of the Exam Room podcast that I think you might find helpful. A while back, I did a 2-part series with our dietitian, Lee Crosby, called Vegan on a Budget. So if you head over to pcrm.org and you actually search Vegan on a Budget, you'll come across these episodes. And she and I actually go to a grocery store and fill up a cart with enough groceries to feed 2 people for an entire week for just a shade over $40. So that information is right there for you. I hope that helps you out and you find a new job very soon. Dr. Barnard, next question comes to you. This one is from Linda on Facebook. She writes, I'm vegan with severe osteoporosis. Besides weight-bearing exercise, what should I do? Are there supplements I should be taking?
Great question. In fact, actually, before we jump into osteoporosis, let me come back to something that Dr. Loomis mentioned about iron. And let me underscore the importance of something he said, which is that we're better off getting our iron from plant sources than animal sources because plant sources are the ones where your body can regulate it. And it's not just that plant sources give you the iron, they also allow you to not get too much iron. Back in the 1950s, people thought the more iron, the better. And then they realized that iron can increase the risk of heart disease. And now we know it can increase the risk of Alzheimer's disease. So getting too much iron can be a disaster. So plant-based iron, that's the way to go. And if you have any doubt, don't go out and buy iron pills and things like that. Have your doctor just test your levels. It's really, really easy to do if you have any doubt. And your green leafy vegetables are going to keep you in iron. Okay, so about your question about healthy bones. It's true that your bones do need calcium. So you need a good source of calcium. You're not going to have dairy, needless to say, on a healthy diet. But that's okay because plants are what supply the calcium that ends up in dairy anyway. Cows don't make calcium. They get calcium from the plants they eat, and we do the same. So you'll get plenty of calcium from broccoli and Brussels sprouts and kale and collards and the other green leafy vegetables. Step 2, you need to absorb that calcium, and your body will absorb it better if you have plenty of vitamin D on board. Where does the vitamin D come from? It comes from the sun. So if you have 20 minutes or so of sunlight on your face and arms every day, you're going to do well. But if you live in North Dakota, where I grew up, then all January, February, March, and April, you're not getting any vitamin D from the sun. So a supplement is a good way to go. Most doctors would say about 2,000 international units a day. It's also important to get good weight-bearing exercise, although I would argue that there's not a strong line between aerobic exercise like running and weight-bearing exercise like weightlifting, because when you're running, your spine and your hips are weight-bearing too. So any kind of exercise is good. Don't forget to get a good evaluation from your doctor, needless to say, but those are some tips that should get you in the right direction.
All right. If you have a question for Dr. Barnard or Dr. Loomis, go ahead and post that in the comments section now. The doctor's mailbag is open. Next question for you, Dr. Loomis, comes to us from Patricia at 1215. She writes, I'm intolerant of raw nuts. Is it better to eat them roasted or just to avoid them?
Well, if you can tolerate roasted nuts, certainly nothing wrong with that. Now nuts are healthful. They're part of a healthful plant-based diet. You do need a little bit careful, though. Nuts have a very, unlike many other plant-based foods like broccoli, nuts do have a fair amount of fat, and it's easy to overconsume nuts. I know if I were to go to Costco and get a big, huge thing of roasted peanuts or roasted almonds, I could eat handfuls, which is not good. So there's nothing wrong with roasted nuts, but just be mindful of the serving size. I mean, you want to limit yourself to like a little handful here a day, a quarter cup or so a day would be helpful.
All right. Sticking with you, Dr. Loomis, this one comes to us from a dietitian at 1214. She says, I have a kidney dialysis patient. How can I improve their hemoglobin level as I'm giving him a whole grain and iron-rich diet? It kind of goes back to what you and I were talking about earlier.
Well, the problem with patients on dialysis and with kidney failure, the kidneys make a hormone called erythropoietin. And erythropoietin triggers our bone marrow to make more red blood cells. And that hormone's actually made in the kidneys. And people with chronic kidney failure actually don't make that hormone anymore. So sometimes it's very difficult. Some chronic anemia can be a problem with dialysis patients because they don't make erythropoietin. In fact, many dialysis patients, they get injections of erythropoietin on a regular basis to help maintain their blood counts, and that's exacerbated because the act of dialysis it can kind of break apart some blood cells, so you lose some blood in the dialysis process if you're doing hemodialysis. So typically, it is important to maintain good iron levels. That's very important because you do have this kind of chronic blood loss with with the dialysis itself, and it sounds like you're doing a great job advising your patient, but it may not be enough, and certainly he should talk to his renal doctor about further treatment. And by the way, that same hormone, is used for doping and endurance sports because you inject the erythropoietin, it increases your red blood cells, which carry oxygen, and so it provides a performance advantage. And it's outlawed. It's been banned in every by the Olympic Committee in every endurance sports.
Dr. Barnard, next question comes to you from Susan at 1220. She wants to know, does pureeing beans reduce their fiber content?
Wonderful question. The short answer is no. The pureeing beans is a fine thing to do. It alters the texture, makes them more palatable for some folks, and it will break up the fiber to a degree, but the fiber is still there.
Sticking with you, question from 1223. This one comes to us from Denise. If we aren't able to do 100% plant-based, at what point would we begin seeing benefits of eating this way? For example, if I do 80% plant-based, will I still see benefits?
Well, first of all, any step that you make toward a plant-based diet is a good step. So you can pat yourself on the back for doing that. But if you're saying you can't do it 100%, I guess I would think, why not? What's getting in your way? It's sort of like, can I not be 100% non-smoker? If I'm an 80% non-smoker, will that help? And the answer is sure. Your lungs are glad to get rid of 80% of the tobacco. But if you've got a little cough left, getting rid of that last cigarette is a good thing. Your cholesterol test is kind of the same way. And so are weight issues and blood pressure. Meaning, when a person gets most of the animal products out of their diet, they do better. But it's surprising to see the difference between having a little animal products here and there and getting them out completely. What you discover is that weight loss is easier. Getting your cholesterol down is more effective. And for that person who couldn't quite get rid of their diabetes, very often that's the change that helps them. So if the issue is just a psychological one, like I'm a little addicted to cheese or something, I can't quite give it up, let me encourage you to focus on the short term. Get rid of something, but for a short period of time, 3 weeks. For the next 3 weeks, no animal products. That makes it easier to do. And once you got 3 weeks under your belt, you'll just view the world in a different way, and it makes it easier to go from there.
Heading back over to the Barnard Medical Center for the next question, and Dr. Loomis at 1223. This one comes to us from Laura. She writes, why does HDL drop when one switches to a plant-based diet?
So that's a very interesting question, Chuck. So HDL cholesterol, so when we look at total cholesterol, it's made of several components. We have the LDL cholesterol, which is the bad component. We have the HDL cholesterol, which at high levels is a negative risk factor. It actually reduces risk for heart disease, typically when it's above 60. And then we have VLDL, very low density lipoprotein, which tracks along with triglyceride levels. And it's not uncommon to see people who go on a really rigorous, low-fat, very high-fiber, plant-based diet to see their HDL levels actually drop. And the reason is the function of HDL, high-density lipoprotein, is reverse cholesterol transport. So it goes out in the bloodstream and gathers up cholesterol molecules and takes them back to the liver to be kind of remetabolized. And the thing is, when your cholesterol levels drop quite low, typically I see that when cholesterol levels are in the 150 range and LDL levels are down, 50, 60 range. Oftentimes, it's not uncommon to see HDL levels drop as well. And that actually happened to me. In medical school, I was a pretty avid runner, I was a marathon runner, and my cholesterol numbers, my total cholesterol was maybe 220. My LDL was a little on the high side, 110 or so, but my HDL was almost 80, quite high. Fast forward 45 years or so, now I probably exercise more than I did in medical school. So theoretically, exercise is one of the things that raises HDL. So theoretically, my HDL should be much higher. Well, now my total cholesterol is 150 and my LDL is mid-50s and my LDL is mid-50s and my HDL is 38, which is low, so less than 40. So, and sometimes it's hard to convince the cardiologist that that's not an issue because because again, high levels of HDL are associated with lower risk, lower layers of heart disease, low levels of HDL are associated with increased risk, but that risk disassociates when your LDL levels drop into the 50s and 60s. So it's really nothing to worry about. But it's because your liver stops making it because you just don't need it anymore.
Dr. Loomis, bring in the science. All right. If you have a question, keep on posting it. We have time for a few more on the program today. Dr. Barnard, coming back to you for this one from Kim at 1224. She writes, I have PCOS and I'm vegan and I try to eat whole food plant-based most of the time. Is it recommended to take vegan pea protein? I don't exercise much, but I do walk. I hear that the PCOS girls should increase their intake of protein. What do you think?
Pea protein is fine. Will it help your PCOS? Not particularly. You don't need to take in extra protein to counter PCOS. For people who don't know what we're talking about, polycystic ovary syndrome is a condition that was diagnosed way back when some women were shown to have cysts on their ovaries. And along with it, they had some what you might call sort of masculine traits, a little bit of maybe a dark facial hair here or there, sometimes weight gain, and their cycle was all goofed up. And as time went on, researchers discovered that it wasn't the cysts causing all these problems. The problem was they had just a little extra male hormone. As you know, everybody has both. Men and women both have male hormones, female hormones. With PCOS, you just got a little extra male hormone that's kind of goofing these things up. The reason people have started pushing protein, and mistakenly in my view, is that along with PCOS comes a condition called insulin resistance, where your body is not handling insulin very well. So people get a little bit of a high blood sugar and some other issues. And so as part of the old-fashioned low-carb school, people would push protein. Mistake. Don't do any of that. Just if you're on a vegan diet now, that's where you need to be, plant-based diet, and the pea protein is fine like any other protein. But here's the key. Keep all oils really low and all fats low. No animal fat, obviously. But keep oils really low too, so the nuts and guacamole, keep those low. What that'll do is that will keep the fat from building up in your muscle and liver cells. That will allow your insulin to work well, and your insulin sensitivity will be tackled and you'll feel better. In my new book, Your Body in Balance, if you don't mind my mentioning it, I do have a whole PCOS chapter, and you'll read about what I've just described, how to put it to work, and about a really wonderful success story of a dietitian in Wisconsin named Allison who had an amazing victory over PCOS.
Okay, time for just two more here. Kelly White checking in at 1225. Kelly, my heart goes out to you. Dr. Loomis, this one is coming your way. She writes, I've been following a whole food, plant-based, no oil diet on and off for 5 years, but really closely over the last 8 months. My weight loss has been slow and ever slower lately, with only 1 pound lost this month. I'm watching my portions and I'm not consuming nuts. I walk for a half an hour a day. I still have 30 pounds to lose. I'm 57. I'm postmenopausal. Do you have any suggestions?
So, when patients plateau on weight loss, there's a couple things to consider. So one is to be sure there's no underlying metabolic issues, in particular thyroid disease. Thyroid plays a role in our metabolism. So if you haven't had a thyroid check in the recent past, I'd certainly encourage you to do that. The other thing that sometimes happens is with exercise, when people start to adapt a healthier lifestyle, they start an exercise program and they burn a lot of calories, and that helps them lose weight. But what happens is, as you continue exercising, the amount of calories you burn exercising has to do with the amount of work you do, and the amount of work you do is determined partly. You can kind of measure that by your heart rate. And a rough rule of thumb is you can kind of predict your maximum heart rate. It's a formula, 220 minus your age, and that equals your theoretic maximum heart rate. And you want to be sure your heart rate's about 60 to 80% of that range for 30 minutes up to an hour every day. And what happens is that you go out for a 30-minute walk, and when you first start when you first start exercising, your heart rate's up 110, 120, and all is good. But as you get in better physical condition, which is a good thing, not a bad thing, all of a sudden that same amount of work, all of a sudden now your heart rate's only getting up to 90 or 100. So you're not burning nearly as many calories. So I would highly encourage you to monitor your heart rate and just be sure you're meeting those goals. And again, sometimes just increasing the intensity, the duration of the exercise as well, adding another 10 or 15 minutes. It can even be done separately. There's evidence to suggest that, say, a 130-minute and 15-minute session are almost as beneficial as a 45-minute session. And then lastly, as far as diet goes, unfortunately, the human brain is not very good at judging how healthful our food is. And sometimes I will have patients just to spot check and be 100% sure there's no holes in your diet is use an app like Chronometer or MyFitnessPal. Keep a food diary. It's tedious, but keep a food diary, say, for a 24, 48-hour window every couple of weeks, and just spot check, that you're meeting your nutrition goals. And there's really only two things you need to pay attention to. You want to be sure your fiber intake is greater than 50 grams, hopefully closer to 100, because that's going to make you feel full, and because of the nutrient density of the food. And then secondly, being sure your fat intake is less than 15% of your total calories, preferably closer to 10. Because again, every gram of fat you consume has 9 calories. Every gram of protein or carbohydrates, 4 calories. So really being 100% sure you're really and truly following a low-fat diet is important. A friend of ours, Anthony Lim, Lim, has a great YouTube video, a lecture on nutrient density, which I found many patients who have reached a weight loss plateau have found helpful. And if you just Google that, you'll be able to find that. I'd encourage you to watch that as well.
All right, Dr. Barnard, the final question is yours. And this is one that actually a lot of people have been wondering about today in the comments. They're wondering about the effectiveness of hydroxychloroquine. There's been a lot of chatter about that this week, and people are curious. What do we know about that?
You mean that hasn't died yet?
Not just yet, sir.
Okay, hydroxychloroquine. Okay, this is one in the family of anti-malarials that when the pandemic arose, the first thing you want to do is see if any of the medications you got now can work against this coronavirus, because you don't have time to make new medications. And so that was one of the ones that was tested, and there was some early not very good indications that it seemed helpful. And so a lot of people started cheerleading for hydroxychloroquine, thinking that would give us a good treatment and we could open up businesses and life could get back to normal. The jury came back into the room, and the jury foreman has a verdict. And I got to tell you, hydroxychloroquine does not work. It's really pretty much a dead issue in the world of science. We wish that it did work. It can be harmful, as you have heard in the press reports, which are true, that for some people it will cause arrhythmias that can be fatal. So no. An anti-malarial, yes. For COVID-19, no.
There you go. All right. Time to close up the doctor's mailbag for today. If we didn't get to your question, we will log it and try to get you an answer on a future show. So have no fear. Dr. Loomis, while you are still here, I can't let you go without talking about the recent expansion over at the Barnard Medical Center, bringing new states online with the wonders of telemedicine. This is pretty exciting stuff. Talk to me about this expansion.
Chuck, and we're adding states every week. And just recently, one of our clinicians is now licensed in Georgia, Illinois. Let's see, what are some of the other ones? It was quite a few. So we already have California and New York, Pennsylvania now, the states, the DMV area. Yeah, it's really exciting, actually. And it's such a needed service because lifestyle medicine and, the role that the root cause of chronic disease is so important in keeping you healthful and making you healthier, and being able to expand and offer consultations regarding lifestyle and diet is something we're very keen on and very proud of being able to do. So yeah, at the bottom there, you can see the list. We are also able to now offer medical nutrition therapy in both Missouri and Massachusetts. That's also new. So again, and we're working to get our dietitians licensed in the same states that we're licensed in, so that we can combine the two if we need to. And more states to come. I think Texas is pending and should come online here pretty soon, and several other states. So very excited about that.
Ooh, you're breaking news about Texas. That is exciting. Then we'll be keeping a close eye on that one. And I know that the new roster of states just this week, in the past week, Illinois, Indiana, and Pennsylvania, those are the 3 brand spanking new ones. So that is a great step in the right direction. And I don't know if you've thought about it yet on these terms, but if you add up the number of states where this is available, we are now available in more than a quarter of the country. That's pretty impressive.
Yeah, thank you. And that's just going to get, we're going to get more and more. And if you looked at it on a population basis, we're trying to pick the states with the biggest number of people who need the most help. Again, more to come.
More important than ever. Dr. Loomis, greatly appreciate it. Have a great weekend, my friend.
All right. Thank you.
And Dr. Barnard, the International Conference on Nutrition and Medicine is coming up less than a week from now. Can you believe it? You, sir, are going to be presenting on a number of topics. What are some of the things that you have in the works?
Well, yeah, I have to say it's going to be a really exciting conference. And now because it's virtual, that means it's easier than ever for people to participate, whether they're from the West Coast or Europe or whomever. I hope that they jump in. Personally, I'm going to be presenting 2 lectures on surprising ways that we can control our hormones through food changes. You and I have talked about that before. Sex hormones that cause menstrual cramps, infertility, breast cancer, prostate cancer. That's one lecture. And we have a whole other lecture on thyroid diseases, diabetes, and mood disorders. But let me tip my hat to some other lecturers. Alan Desmond, who's a real genius, gastroenterologist in the UK, is coming and talking to us about Crohn's disease, which for many people has been such a chronic issue. And he's going to share his clinical experience. It's going to be terrific. And one of our flagship sessions has Walter Willett from Harvard, along with Marty Heller from Michigan. And they're talking about what does all this mean, thinking beyond health to the environment, which is going to be great. Kim Williams, terrific friend from Rush in Chicago, is going to talk about COVID, race disparities, and how to really address that situation. So anyway, I'm just scratching the surface. We've got tremendous people joining us, and I hope folks who are thinking about joining the conference will do so. It's Thursday, Friday, Saturday, this next week.
Yeah, you mentioned Dr. Alan Desmond. He was on yesterday's episode of the Exam Room podcast, so you can go check out that interview right now on Apple Podcast or Spotify, wherever shows are available. But here's something really exciting we haven't mentioned yet on the show. He will also be here live next Wednesday to preview his presentation and answer your questions right here live on the Exam Room Live. So that is very exciting stuff. Even more exciting, Dr. Barnard, we have a special offer just for Exam Room Live viewers. If you register right now at pcrm.org/ICNM and you use the promo code EXAM and the number 20, lowercase exam and the number 20, you will save 20% off the cost of registration. A fantastic deal. We're talking about 3 days full of the latest research on health and nutrition, sure enough to get you educated and inspired, coming up August 6th through 8th. Dr. Barnard, appreciate your time. Really looking forward to ICNM being virtual this year.
It's going to be great. For anybody who's participating, be warned. This is the real deal. We bring you the top scientists. Sometimes it even gets a little bit on the technical side because it's for doctors, dietitians, and scientists. So fasten your seatbelt. It's the latest in the world of nutritional science.
Yeah, I call it nerding out with nutrition. That's exactly what it is, and it is absolutely fantastic. So, Dr. Barnard, I greatly appreciate it, my friend. We'll talk to you again soon.
Thank you, Chuck.
All right. And that is indeed going to wrap things up for us this week. And coming up on Monday's show, we're going to be joined by the one and only Chef AJ. She's going to be here on Monday to kick the week off with us. But until then, I hope that you have a fantastic weekend. On behalf of Doctors Neal Barnard and Jim Loomis and everyone here at the Physicians Committee, I am the weight loss champion, Chuck Carroll. Until Monday, please remember to stay safe, take a stand, and keep it plant-based.